When most people think about balance problems, they picture leg strength or dizziness. But few realize that what you wear on your feet can literally make or break your stability. Let's talk about shoes. Every step you take depends on a complex network of sensors in your feet, ankles, and toes. These sensors communicate with your brain, helping you stay upright and aligned. But here's the shocker. Wearing the wrong shoes, even inside your home, can completely shut down that communication. In fact, a landmark study from the Journal of the American Geriatric Society found that over 60% of seniors who experienced a fall were wearing slippers, sandals, or socks at the time, not because of clumsiness, but because their shoes weren't supporting their balance systems. Let that sink in. Your shoes, or lack thereof, might be silently increasing your risk of falling. So what's the problem with most senior shoes? Here are the 4 biggest balance killers when it comes to footwear. Too soft or unsupportive soles. Many shoes marketed as comfortable are actually too squishy. This disconnects your foot from the ground, making it harder for your body to detect where it is in space. Open back slippers or flip-flops. These offer zero ankle support and allow your heel to move freely, creating instability with each step. Worn-out soles or uneven tread. As shoes wear down, they lose grip and balance alignment. This uneven wear subtly shifts your posture, increasing your fall risk without you even realizing it. No shoes at all. Walking barefoot or just in socks, especially on slippery floors, removes all grip and foot control. Seniors often think it's safer to feel the floor, but it actually reduces protective feedback. So, what should seniors wear instead? Here's the fix. Supportive, non-slip shoes even at home. Look for shoes with a firm heel cup, non-slip rubber soles, and wide toe boxes to help your foot grip properly. Avoid going barefoot on hard floors. If you must, use non-slip grip socks with rubber dots on the bottom, but this should be temporary, not your daily habit. Replace your shoes regularly. A good rule of thumb: if the treads are smooth or uneven, it's time to replace them. Consider orthotic inserts. If you have flat feet or foot pain, custom or off-the-shelf orthotics can improve alignment and stability dramatically. Pro tip: do a quick slip test at home. Try gently sliding your feet side to side in your current shoes on your regular flooring. If they move easily, they're not giving you enough grip. Here's why this matters so much. Balance starts with your foundation, and your feet are your foundation. If that base is unstable, your entire posture chain becomes reactive. That means more swaying, more missteps, and more fear of falling. We're going to talk about what happens when your ears, yes, your ears, start messing with your balance in Part 3, and how to retrain them without medication. This may surprise you, but your ability to stand upright, walk straight, or even turn your head without getting dizzy is deeply connected to your ears. Not your hearing, but a tiny balance system inside called the vestibular system. Let me explain. Inside your inner ear, you have a network of fluid-filled canals and sensory hair cells. Together, these detect movement, acceleration, and the position of your head relative to gravity. They constantly send messages to your brain, telling it how to adjust your eyes, muscles, and posture to keep you balanced. It's like your body's internal gyroscope. But here's the catch. After age 60, the vestibular system starts to decline. The fluid thickens, the sensors become less responsive, and sometimes tiny calcium crystals in the ear, called otoconia, get dislodged, sending confusing signals to your brain. This condition is called benign paroxysmal positional vertigo, and it's one of the most common causes of dizziness and falls in older adults. The symptoms? Feeling like the room is spinning when you roll over in bed. Sudden dizziness when you look up or bend down. A strange sensation that your head is moving even when it's still. And guess what? Many seniors dismiss these signs as just getting older when they're actually signs of vestibular dysfunction. According to a study published in Archives of Otolaryngology Head and Neck Surgery, nearly 35% of Americans over 40 have some form of vestibular dysfunction, and it becomes even more common over 60. Here's the good news. You can retrain and reawaken this system. Here's how. 1. Do daily vestibular exercises. These are simple head and eye movements that help recalibrate your inner ear's balance function. For example, gaze stabilization. Focus on a fixed point on the wall. Slowly turn your head side to side while keeping your eyes locked on the point. Do this for 1 minute. Head turns while walking. Walk slowly in a straight line while gently turning your head left and right. This forces your brain to integrate motion and balance. These may feel awkward at first, but they work. A clinical trial from Physical Therapy Journal found that seniors who performed vestibular exercises 3 times a week significantly improved their balance and reduced falls by over 40% in just 6 weeks. 2. Sleep with head support and avoid sudden position changes. If you experience vertigo, especially at night, try using an extra pillow to elevate your head slightly. Also, avoid rapid position shifts like jumping out of bed or bending down too quickly. 3. Talk to your doctor about vestibular rehab. Many physical therapists specialize in balance therapy. If your symptoms persist or worsen, a professional can create a customized routine to reset your inner ear coordination. And here's a tip for everyone over 60, even if you don't feel dizzy now. Start doing these exercises before problems begin. They act as preventative maintenance for your balance system, like tuning up your inner ear so it stays sharp and responsive. In the next part, we're going to address one of the sneakiest and most common contributors to poor balance: medications. Some of the pills you take every day, even the ones prescribed for blood pressure or sleep, may be dulling your balance reflexes without you even knowing. Why do so many seniors suddenly struggle with balance, even when they feel mostly healthy? You get up from the couch and feel a little unsteady. Maybe you've started grabbing onto furniture to make it across the room. Or you avoid certain stairs, not because you're tired, but because you're unsure if your body will keep up with your intention. Sound familiar? Well, if you over 60 or care about someone who is, this might be one of the most important things you hear all year. Because the truth is, balance problems aren't just an inevitable part of aging. They're a warning sign. And if you know how to respond, you can prevent a dangerous spiral. Here's a surprising fact. Over 36 million falls are reported among older adults in the U.S. every single year. And nearly 1 in 5 of those falls causes a serious injury, like a broken hip or head trauma. But here's what most seniors don't know. In over 70% of these cases, the root cause of the balance issue could have been fixed. Not with surgery, not with pills, but with small daily changes that nobody ever talks about. So in this video, we're going to reveal the #1 cause of balance decline in seniors over 60, and exactly what you can start doing about it today. And we won't stop there. We'll walk through the 6 most common balance-destroying habits, nutritional deficiencies, and overlooked medical risks that creep in after 60, and how to fight back. This is critical if you want to stay independent, mobile, and confident in your body. Because the truth is, most seniors don't fall because of a sudden accident. They fall because their balance has slowly been failing for years, and no one warned them. Let's fix that right now. We'll get to nutrients, medications, and brain-body coordination in a moment. But we have to start with the biggest culprit, and one that silently weakens millions of people after the age of 60: sarcopenia. Sarcopenia is the medical term for age-related muscle loss. But this isn't just about losing strength. It directly affects your balance, posture, and how your brain communicates with your body. Sarcopenia is the medical term for age-related muscle loss. But this isn't just about losing strength. According to a study published in the Journals of Gerontology, adults over 60 lose about 3 to 5% of their muscle mass each decade, and that number increases even faster with a sedentary lifestyle. Now here's where it gets dangerous. You might not feel weaker. You might not even notice that you've lost muscle in your legs or core. But one day, you misstep. You reach for something and feel your foot slip. You recover, but it shakes you. That moment, that split second of instability, is a symptom of sarcopenia doing its quiet damage. Why does muscle matter for balance? Because muscles, especially in your legs, hips, and core, are what keep your body upright, aligned, and responsive. When they're strong, you can catch yourself, correct your posture, or step quickly if you trip. When they're weak, your reaction time slows, your base becomes less stable, and falls become more likely. And sarcopenia doesn't just affect strength. It changes how your brain senses your body, a process called proprioception. That's the body's natural GPS system. And without enough muscle, your GPS gets scrambled. Here's the good news. You can reverse age-related muscle loss. And you don't need to become a gym rat to do it. Here's how to fix it. Start with this proven 3-part strategy. Prioritize protein. Most seniors eat far too little protein, especially early in the day. Aim for 25 to 30 grams of high-quality protein with each meal. Eggs, Greek yogurt, chicken, fish, or plant-based options like lentils and tofu all count. Use resistance. Walking is great, but it's not enough. You need resistance-based movement. This can be as simple as body weight squats while holding a chair leg lifts, lying on your bed, climbing stairs a few extra times per day. Vitamin D3 and magnesium. A review from Nutrients. Journal showed that low levels of these nutrients were directly associated with muscle weakness and increased fall risk. Consider asking your doctor about a supplement, especially if you're indoors most of the time. And remember, even small daily movements signal your muscles to stay active. The more you move, the more your muscles remember how to support you. We'll cover what happens when nerves get involved and how your inner ear might secretly be sabotaging your balance in just a moment. But first, let us look at something even more common that most seniors don't realize they're doing wrong every single day. Here's a question most seniors never think to ask. Could the very medications meant to protect your health be putting your balance at risk? If you're over 60, the answer might be yes. In fact, a study published in Drugs and Aging found that nearly 80% of older adults take at least one medication that increases their risk of falls. And worse, many are on multiple medications, a condition called polypharmacy, which compounds the danger. Let's break down why this matters. Your balance is a highly sensitive system. It depends on fast communication between your brain, inner ear, muscles, eyes, and nerves. But certain medications, even common ones, can slow your reflexes, dull your senses, or cause drops in blood pressure, creating the perfect storm for imbalance. Here are the biggest culprits. 1. Blood pressure medications. While essential for heart health, these can sometimes lower your blood pressure too much, especially when you stand up. This leads to orthostatic hypotension, a sudden drop in blood flow to your brain, which can make you feel dizzy, foggy, or faint. Fix. Ask your doctor to test your blood pressure in multiple positions. You may need an adjustment or to space your doses more carefully. 2. Sedatives and sleep aids. Drugs like zolpidem, benzodiazepines, and some antihistamines can slow your reaction time and impair balance, even hours after taking them. A study in the Journal of the American Geriatrics Society found that seniors taking these types of medications were 4 times more likely to experience a fall than those who weren't. Fix. Talk to your provider about natural sleep alternatives like melatonin, sleep hygiene routines, or low-dose alternatives with fewer sedative effects. 3. antidepressants, and anti-anxiety medications. These can affect the vestibular system and balance centers in your brain, causing dizziness or lightheadedness, especially when you first start them or adjust the dose. Fix. If you're feeling off balance after starting a new medication, don't dismiss it. Track the timing and symptoms and report them immediately. 4. Painkillers. These dull not just pain, but also brain and body awareness, making you slower to respond if you trip or feel unstable. Fix. If you're using prescription pain medications long-term, ask about alternatives like topical creams, anti-inflammatories, or physical therapy. 5. Over-the-counter culprits. Even seemingly harmless meds like Benadryl or nighttime cold medicine can cause major dizziness in seniors. Fix. Always read the label, and remember, non-drowsy doesn't always mean safe for balance. Now here's the big idea. You have the right to question your medication list. Bring your full list, prescription and over-the-counter, to your doctor or pharmacist and say, "Can you tell me if any of these might affect my balance?" This simple question could prevent a serious fall, because balance is not just about strength or coordination. It's about maintaining a clear, steady signal from your brain to your body, and many medications interfere with that. And sometimes, it's not even the medication itself. It's how multiple medications interact with each other. That's why you need a medication review at least once a year, or whenever something feels off. In the next part, we're going to address something equally important and often forgotten: how your eyes are secretly controlling your balance, and what happens when your vision starts to fade. Let's begin with the sobering truth. The less you move, the harder it becomes to move. It sounds simple, but behind that phrase is a complex neurological reality that affects millions of seniors. After 60, many people start avoiding certain activities. You stop walking as far. You avoid uneven sidewalks. You skip the stairs. You hesitate to bend down and pick something up. Why? Because you feel unsteady or afraid of falling. And while that seems like the safe choice, it's actually doing something dangerous. It's rewiring your brain. Let me explain. Your brain and body are in constant communication. Every step you take, every adjustment you make, every time you catch your balance, you're strengthening a complex web of signals between your nervous system, muscles, and sensory organs. But when you stop moving, that network goes quiet. Over time, your brain starts to forget how to stabilize you. Your reflexes slow. Your posture weakens. Your coordination becomes clumsy. This is called neuromuscular deconditioning, and it doesn't just happen from illness. It happens from fear, from avoidance, from simply doing less, and it can become a vicious cycle. You feel unsteady as you move less, as your brain weakens the balance signal, gives you feel even more unsteady, as you move even less, until eventually, a small trip becomes a big fall. But here's the good news. The brain is plastic. It can relearn balance, even in your 70s, 80s, or 90s. You just have to give it the right input. Here's how to fix the brain-body disconnect. 1. Move every single day, even just a little. Balance is a skill. And like any skill, if you don't practice, you lose it. Start with standing on one leg while brushing your teeth, marching in place while watching TV, taking short walks on different surfaces, grass, carpet, tile. These small challenges wake up your body's stabilizing systems. 2. Do dual task training. This means balancing while doing something else, like counting backward while walking, carrying a light object while stepping over obstacles. Studies from the Journal of Geriatric Physical Therapy show that dual task exercises improve both cognitive function and physical stability in seniors. 3. Address the fear directly. Many seniors fear falling so much that it paralyzes their confidence. But here's what the research shows. Fear of falling increases your actual risk of falling. Why? Because it changes your gait. It shortens your stride, tightens your posture, and reduces your natural reflexes. Fix. Rebuild confidence with safe, repeatable movement. Use support devices at first, not as a crutch, but as a tool for independence training. 4. Engage in guided balance programs. Tai Chi, yoga, and guided physical therapy are excellent for seniors. They don't just improve strength. They reconnect your brain and body in a mindful, progressive way. One study published in the New England Journal of Medicine found that seniors practicing Tai Chi reduced their fall risk by over 45% compared to those doing standard exercise. And here's the truth that brings all of this together. Balance isn't just physical, it's deeply neurological. It's about rebuilding trust between your brain and body, one small movement at a time. Now, let's bring it all home with a short, powerful conclusion. By now, you've learned how muscle loss, medications, footwear, vision, inner ear changes, and brain-body disconnect all contribute to balance problems. But there's still one more factor, and it might be the most silent of them all. It's something that affects your joints, your nerves, your muscles, your brain. And yet, most seniors have never connected it to balance. We're talking about chronic inflammation. Now you might be thinking, isn't that just something that causes joint pain? Yes, but it goes much deeper. Chronic low-grade inflammation, the kind that simmers quietly in the background for years, can actually disrupt the communication between your nervous system and your muscles. And when those signals become delayed or muffled, your coordination suffers. Let's break it down. How inflammation disrupts balance. It slows nerve conduction. Inflammation in the body, especially in the spine or peripheral nerves, slows down the speed at which electrical signals travel from your brain to your muscles. So if you trip or slip, your body is slower to respond. It causes joint instability. Inflamed joints, especially in the knees, ankles, and hips, alter your posture and step mechanics. You start compensating, putting more weight on one side, shuffling instead of stepping, and that throws your entire balance system out of sync. It affects your inner ear and brain. Some research from Frontiers in Aging Neuroscience suggests that systemic inflammation may even interfere with your vestibular system and cerebellum, key players in maintaining equilibrium. Signs your balance issues might be inflammation-related. You feel stiff in the morning and unstable when you first get out of bed. You experience joint swelling, especially after sitting or standing too long. You have autoimmune conditions like rheumatoid arthritis or inflammatory bowel disease. You've noticed your balance worsens when your pain flares up. Sound familiar? Here's the good news. You can reduce inflammation and improve your balance with small, consistent changes. Here's how to reduce inflammation naturally. 1. Eat anti-inflammatory foods. Build your plate around leafy greens, berries, fatty fish, olive oil, turmeric, garlic, and ginger. Limit processed sugars, deep-fried foods, white flour products. These inflame not just your gut, but also your nervous system. 2. Move daily, even with joint pain. Yes, inflammation makes you want to rest. But movement is one of the best natural anti-inflammatories. Gentle activities like walking, tai chi, swimming, or cycling can reduce joint inflammation by increasing circulation and flushing out inflammatory byproducts. 3. Get better sleep. Poor sleep increases inflammatory markers. Aim for 7 to 8 hours per night with a wind-down routine that avoids screens and caffeine. 4. Reduce stress. Chronic stress triggers cortisol, and excess cortisol promotes inflammation. Try breathing exercises, meditation, prayer, or relaxing music. Just 10 minutes a day can lower inflammatory markers. 5. Talk to your doctor about key supplements. Some seniors benefit from turmeric curcumin, omega-3 fatty acids, Magnesium and vitamin D3. These are known to lower inflammation and support nerve and muscle health. Let's bring it all together. Balance isn't just about what's happening on the outside. It's also about what's happening inside. And chronic inflammation is like a slow fog that blurs your body's response time. The less inflamed you are, the more clearly your brain and muscles can work together, and the steadier your steps will feel. So if you're already working on strength, vision, footwear, and movement, don't forget to address inflammation, because even the most stable body can stumble when it's inflamed. And now, with this final piece, you have a full 360-degree plan to protect your balance, rebuild your confidence, and stay standing strong well into your 60s, 70s, 80s, and beyond. Let's take a step back and look at the full picture. If you or someone you love is over 60, here's what you now know. Balance loss isn't just about aging. It's about muscle loss, especially in the legs and core. It's about the shoes you wear and whether they're helping or hurting your stability. It's about your inner ear and whether your vestibular system is still sharp and calibrated. It's about the medications you're taking and whether they're interfering with the signals your brain needs to stay steady. It's about your vision and whether your eyes are giving your brain accurate feedback. And most importantly, it's about how often you move and whether you trust your body to move at all. Balance doesn't vanish overnight. It fades slowly, day by day, as signals go quiet, muscles get lazy, and the brain loses connection with the body. But the opposite is also true. Balance can be rebuilt. Every walk, every squat, every step you take on a new surface, every movement you make while staying engaged and alert, it all sends a message. I still need this body. I still trust it. I'm not done. And you're not. Because no matter your age, you deserve to feel confident standing up, walking across a room, climbing stairs, or dancing at your grandchild's wedding. You deserve to feel steady and safe. So here's what you can do starting today. Move a little more than you did yesterday. Check your shoes and your glasses. Talk to your doctor about your medications. Practice a balance exercise right now, even if it's just standing on one leg while holding the counter. Most people wait until after a fall to take this seriously, but not you. Because now, you know the signs. You know what to do. And you know it's not too late. Your balance isn't gone. It's just waiting for you to wake it up again. So go ahead, take that first step, because strength, confidence, and stability can begin again today.